Coming to you in high definition, this is the Fox 9 Morning News.
Well, if you are seeing red today, or better yet, wearing red, there is a good reason for that.
Yeah, today is the American Heart Association's National Wear Red Day. It's, of course, part to make everyone aware of heart disease in women. Of course, it's the #1 killer of both women and men. M.A. Roscoe joins us live from Mall of America, where a whole bunch of Go Red for Women events are happening. M.A.
And by a whole bunch, I mean dozens, literally dozens of events going on at the Mall of America this weekend, all designed to bring awareness and attention to the fact that heart disease is the #1 killer of women in this country. Now, behind me, you see a little preview. We'll talk about this more later, but it's the Go Red Hearts for Fashion show. That is going on. There is a casting call to find a new Go Red for Women spokesperson. That's going on. But perhaps most importantly, there are some free health screenings going on, both here at the Mall of America tomorrow from 11 to 2, and also at Health East clinics throughout February, throughout the metro. We'll have more information online for that. But I'd like to talk with Dr. Priscilla Hedberg. She's a cardiologist. Believe it or not, this campaign, Go Red for Women, has only been around for 7 years. And it seems like it's been around longer, if for only because it's just everywhere. You can't escape it. You've really gotten the message out. Are women taking the message to heart, pardon the pun, about knowing their numbers, knowing about heart disease?
I think what's really exciting is women are actually showing up with their symptoms long before their heart attack rather than waiting till they experience their heart attack.
And that's good news, because as women, Alex, I don't have to tell you, the long-suffering mom, we take care of other people, we tend to, and not pay attention to ourselves, or just like, I can suck it up or make it through. And that's not a good idea when it comes to heart disease.
Exactly.
All right, well, the screenings, the free screenings will consist of what?
Well, these are all numbers that you can change to prevent yourself from having a heart attack. So, blood pressure, cholesterol, your glucose, your body mass index. You might not want to know that.
I went into this bod pod. Perhaps you know of it. I went into this bod pod at the U, and I found out I'm not quite as lean as I'd like to be, but I don't believe I'm in, as Kenny Loggins would say, the danger zone. So it's important to know those numbers and know your risk factors. Now, just if there's one thing that you could do, if you're a smoker and you stop smoking, automatically your risk would drop tremendously.
Exactly. In fact, I keep telling people if they quit smoking, I'm not going to get my kids through college. So
it's true. There you go. How many women do you think do know their numbers? This is part of the campaign. I mean,
well, as part of the campaign, we can see that we're making impact. We've clearly made impact as far as preventing heart attacks. I think the number push now is to get the prevention before the people present with heart attacks. So it used to be 5-7 years ago that we were looking at numbers of like less than 30% that knew their numbers. Now we're getting up more 50 in that range, but there's a lot of room to go.
Well, of course, part of the reason this campaign is so important is that these are largely preventable.
Exactly. The vast majority of heart disease in women, particularly young women, is preventable. And those young women under the age of 50, they're the ones that have the high risk of dying when they do have their heart attack.
Okay, well, if you want to know your numbers, you can do that this weekend, actually tomorrow at Mall of America from 11 to 2. And again, online, we're going to have a list of Health East clinics throughout February where you can get free screenings as well. When we come back, we're going to talk a little bit more about another Go Red event, and it has to do with Jiffy Lube. That's all I'm going to say. That's all I'm going to say.
Okay.
I know they're not doing health screenings there.
I know.
But that's all I'm going to say.
Couple quarts low.
Okay.
Couple quarts low. All right. Thank you, M.A.
Hey, looking good in red.
Yes, she is.